blaming the victim. Let's skip down to that. The uninsured are telling us something. What they are telling us is that the coverage that's out there is not valuable to them. Even when it's free, it's not valuable to them. Something like 1/3 of the uninsured are already eligible for Medicaid or S-CHIP, free. No cost at all. And 1/3 of those have been on the program within the past 12 months. They know how to enroll, they know what it's about, they know how to use it, and they don't bother re-enrolling because it's of so little value that it's not worth the trouble even though it's free. Why is it of little value? Because Medicaid pays doctors so little that even if you're on the program, you can't find a doctor to see you. So nothing in your life changes. When you're feeling poorly, you roll down to the ER because that's where the doctors are, just like you did before. Nothing has changed. So why should you bother enrolling just to please some bureaucrat that's counting noses? It's not a good proposition. And for people that aren't eligible for Medicaid, state legislatures have loaded up health insurance with so many unnecessary mandates that it doesn't seem worthwhile. Things like in vitro fertilization. I'm 62 years old. Why do I need in vitro fertilization coverage? I'm out of that business. We ain't doing that. Why should I waste my money on it? It's not a good deal. It's not a good value. It is the politicians that have been irresponsible, not the people. If they let the market alone, the insurance industry would develop products that would appeal to the people that have decided not to buy coverage. If they allowed the market to work the way it is. 46 million uninsured people is an enormous market opportunity. I mean, if you could come up with something for $50 a month that would cover them, and $50 a month they might think it would be worthwhile. It may not do all the bells and whistles that members of Congress would like to see, but it's not members of Congress that are making the decision to buy or not to buy, or at least it hasn't been. They would like it to be. All right, the insurance exchange. The insurance exchange simply adds another level of regulation and costs and mandates. It is based on the notion of interstate commerce, where part of the Constitution allows there to be unobstructed interstate commerce between the states. Unfortunately, Congress, I mean, all the sources, the source of all the problems in our healthcare system are from government. And this is one of them. Congress in 1947 passed the McCarran-Ferguson Act, which said that only the states will be allowed to regulate insurance, not just health insurance, all kinds of insurance. And so they violated the principles of interstate commerce when it comes to insurance. Now, they could simply repeal McCarran-Ferguson and we would have a wide open national market for health insurance again. But they're not likely to do that because that would mean they would have to admit that they made a mistake. All right. In Massachusetts, they did pass a mandate that included a connector. And part of what is happening in Massachusetts, first of all, the people that we're trying to help in Massachusetts, those previously uninsured people, the ones directly affected by the mandate, are telling pollsters that the mandate is hurting them and not helping them. Bob Blendon at Harvard does surveys, and he asked the people affected by the mandate in Massachusetts, how is this doing? And 20% of the respondents said it is helping me. 60% of the respondents said it's hurting me. So these people that we care about so much and we're trying so hard to help are telling us that what we're doing is hurting them. What kind of public policy is that? Massachusetts also has by far and away the largest number of doctors per capita. And it had one of the lowest rates of non-insurance in the country, like 9.5%. And since they passed their mandate, all of a sudden the waiting times to see a doctor have soared to 2 and 3 and 4 months just to see a primary care doctor. It is by far now the longest waiting times of any state in the country. And if you take a state like California, where it's 20% uninsured and not nearly as many doctors as Massachusetts had, and try to get all of those people into an insurance coverage, the demand to see doctors is going to be huge, huge. The system cannot accommodate it. All right. Medicaid has blah, 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 blah. All right. One of the interesting things about Medicaid is that all the studies I've looked at, I've looked like at 170 different studies that look at this. They all, virtually all of them, not every single one, but the vast majority of them say that the outcomes of people on Medicaid are worse than being uninsured. Your outcomes, your chance of survival, your chance of good health if you're on Medicaid are lower than it is if you're uninsured. The thing that determines health is not the presence or absence of insurance. It is education and income more than anything else. Those are, in every system in the world, it is education and income that determines how healthy a person is, not whether they have insurance. Insurance is a marginal factor in improving people's health. Look, none of this stuff deals with the essential problem. The essential problem is third-party payment. It's where a consumer pays the insurance company a premium to pay the doctor to provide services to the consumer. Third-party payment. This is not insurance, by the way. This is third-party payment. I worked for a long, long time at Blue Cross. Blue Cross started this concept back during the Depression when they were trying to make sure that hospitals were getting paid. That was the primary reason for starting Blue Cross in the first place, is to ensure hospital solvency. So, like all human relations, triangles do not work very well, because one point of the triangle is always wondering what the other two guys are up to, you know. So the consumer, you know, when he's getting a service from a doctor and he's sitting in the examining room half naked, and the doctor comes in with a little clipboard in hand to take care of him, the consumer doesn't know who that doctor is working for. What the consumer does know is that doctor is being paid by the insurance company. So who is the doctor accountable to? Just that you have to ask that question or wonder about that is a violation of the sacred trust between the patient and the doctor. It's a violation. And the insurance company is way too curious about what's happening between the doctor and the patient, to the point where insurance companies have become little peeping toms looking into this intimate moment between me and my doctor. And the insurance companies start sending out health risk assessment forms to find out if you are doing what you should be doing, if you are complying with the doctor. And the insurance company starts looking at the doctor's practice patterns. Are you spending too much time, too little time with your patients? Are you prescribing the right medications? Are you telling them to quit smoking and lose weight? You know, they have these little checklists the doctors have to check off. It's not the insurance company's business what is happening between me and my doctor. The insurance company is supposed to be a financer, not a medical provider. They don't know anything about this, and they shouldn't know anything about this. Third-party payment is the essential problem in healthcare. It's what has made it unaccountable, bureaucratic, inefficient, inconvenient, of high cost and questionable quality. The involvement of third-party payers. And it doesn't matter that much if that third-party payer is private or public, if it's government or if it's a private insurance company. The very notion of this triangular relationship is a violation. So we've been trying to get away from this. And I'm a big advocate of what's known as consumer-driven healthcare. The best known example of it are health savings accounts, but it's not the only example.